yesterday afternoon that a so-called glitch in the system resulted in approximately 2,500 former youth in care who selected MCO plans other than Illini Care from being kicked out of the system entirely. As of yesterday evening, these 25,000 former youth in care have been uninsured since Saturday. These are not glitches. These are major flaws. I am not sensationalizing the issue when I say that children will die as a result of the stubborn resolve to continue moving forward. We urge that the former youth in care receive the same consideration as current youth in care and that their transition be delayed until at least April 1st. Beyond that, we urge that our state not be bound by an arbitrary deadline for transitioning youth into managed care, but instead that we be guided by the goal of ensuring that our current and former youth in care's needs are competently met. No current or former youth in care should be placed in managed care until we can ensure that there is an adequate provider network, that the program complies with state law, that there is a plan for clear communication with children and parents affected, and finally, that basic issues regarding how to identify the youth that are supposed to be served can be resolved. Thank you, and I'm happy to answer any questions.
Thank you, Ms. Gomez, and thank you for a brief statement. I know there is so much more you'd like to share with us. Also today, several letters were received by myself and Senator Staines and other members of these committees from parents and advocates around the state. Those will become part of the official record, but we will not be obviously taking testimony from everyone that's interested in doing so. We will now ask for the ACLU to have their 5 minutes. And good morning, and we'd like to add Senator Menard to the roll, please. Oh, and also Senator Feigenholtz, Senator Villevolam, Senator Peters, welcome. Okay.
Good morning, Chairwoman Staines. I'm sorry. It is? I thought it was on. Got it. Sorry about that, folks. Good morning to the committee. Thank you very much for having me. I'm Heidi Dellenberg of the ACLU of Illinois, and I'm here also to follow up on Danielle Gomez's compelling testimony about the situation we're facing right now. Illinois has been moving toward managed care for Medicaid recipients in Illinois since about 2015. It's been a herky-jerky journey for the entire state. And in about 2017, we first heard the idea that they were going to move foster children and former foster children into that managed care construct. I think it's fair to say that there's been intense concern since that time about the way that the rollout was going to proceed and whether or not children were going to continue to receive care in the way that they should, when they need it, from close by practitioners, and in a way that makes it possible for their families to care for them in a comfortable way. Unfortunately, that's not how things have played out. This body last year passed legislation to try to force adequate planning for the rollout. There were benchmarks set up for HFS and DCFS to honor, and that planning process did not play out the way we all hoped. Starting in January of this year, after the rollout for foster care youth, both current and former, had been delayed several times, we entered into intensive negotiations with DCFS and HFS. We asked them to delay for everyone the rollout that was set to happen on February 1st. We were partially successful, but not completely successful. We were able to get a delay for the children in care, the members of the BH class that I represent in the BH litigation against the Department of Children and Family Services. We were not able to convince the agencies to roll out or delay the rollout for former foster youth. Unfortunately, the very concerns that we raised for current youth in care bled over into and impacted the former youth in care. And what we're now seeing and what we heard from Ms. Gomez is that things have gone very, very badly, at least in the initial days. We know that there have been serious problems. I understand that medical cards were sent out late. We've heard about this glitch in the system where 2,500 children's records were basically inactivated so that the parents could not get care for their kids. What we're trying to do now, in addition to fielding phone calls, and we are answering every phone call we get regardless of whether a family has a former foster youth in care or a current foster child. We're taking those calls, we're advocating for those families. We have received attention from the top levels of HFS and DCFS, but the problem is those are not the people that should be solving these problems. The system should have been set up for people to be able to pick up the phone and get answers and get access to doctors when they needed to have them. I can't put the genie back in the bottle for the former foster youth. I can't undo the fact that that rollout took place. What we have been able to do is to try to prevent that same scenario from happening again at whatever point in time the foster children currently in DCFS care are actually put into the managed care construct. We have negotiated a settlement agreement that sets a framework that is designed to prevent this problem from happening at least a second time. We have built into that settlement the fact that former foster youth in care are not going to be forced only to deal with youth care. They're going to have options for different MCOs to join. Foster parents presently don't know that. We've made sure that they're going to have that clearly communicated to them, and they can have a clear avenue for how to ask DCFS to give them a choice for their child. We have built into this a requirement that HFS show in advance, not after the rollout, but in advance, that there are physicians close enough and of the right type to serve the families that are going to roll into this MCO. There are restrictions in the contract that these folks signed that require them to have providers nearby to families and to have a saturation that makes it adequate for people to get health care in a reasonable way. We want to hold HFS and the MCOs accountable for that contract language. In addition, we want HFS and DCFS, and they have promised to do this, to work to pre-identify the families that have children with complex needs, so that we can work in advance to figure out transitions when doctors have to be changed. We don't want that to happen if we can avoid it, but when it's necessary, we want those families to have advance help, not help the day after the rollout, and not to have the panic that we're hearing about now. And finally, and most importantly, this process under our settlement agreement is going to be monitored by the special master, retired Magistrate Judge Geraldine Sout Brown. She is the person that will be able to see the documentation that we've required. She is the person that is going to be able to judge whether or not HFS and DCFS are ready for the rollout when April 1 occurs. And at that point, she can tell HFS to delay that rollout if she thinks they're not ready.
Thank you. Nikki McGee from News Channel 20 requests permission to video. Permission is granted. I'd like to ask the Department of Health and Family Services to come to the table. So my intention, along with Senator Staines, is for you to provide your remarks, and we're going to then be asking DCFS to come up and make their remarks, and then we'll open the committee up for questions.
Good morning, and thank you so much, Chairwoman Staines, Chairwoman Morrison, Spokesman Severson, and thank you for your continued focus on this extremely important topic. I'm Christine Herman, the Chief of the Bureau of Behavioral Health for Healthcare and Family Services. I'm here with my esteemed colleague, Stephanie Garrett, General Counsel for Healthcare and Family Services. We are here to discuss with you the process that we are utilizing to address concerns raised by stakeholders related to the transition of DCFS former youth in care into the Youth Care Managed Care Plan. There is nothing more important to us than getting this process right. Vulnerable children and families in Illinois deserve quality health care with coordinated services and support. And all of us at HFS are committed to providing that level of care, and we truly believe the managed care plan that we have created will accomplish that goal. That said, we know that this transition has raised a number of concerns, both with families directly impacted and with advocates. We are committed to addressing every concern that has been raised about this process and about managed care in general. We are here today to listen and respond, and we are working literally around the clock every day to do the same. We want to reiterate the process that foster and adoptive parents can use to get their questions answered. We have set up a rapid response process that can be accessed via phone at 844-289-2264 or via email at ilyouthcare@centene.com. We also have cards that are available that have these numbers on them. If anybody here needs that information, please do come get a card. If you are meeting with parents, foster parents, advocates, please take some extras. We want to do whatever we can to get this word out and this number out. We've been utilizing multiple platforms to get this information out to people who need it, and we would appreciate any and all assistance with making sure that everyone has access to it. Before we get into the main part of our opening comments, I want to address an issue that surfaced over the weekend related to the initial enrollment of former youth in care into managed care. On Sunday, we learned of an issue via our rapid response call center involving, as was stated, 2,500 families who selected plans other than youth care and were not fully transitioned into that plan. Those that tried to access services at pharmacies were being told by pharmacies that they were not eligible for either managed care or fee-for-service. And while Tracy Johnson, who is the head of the youth care implementation team, worked with the individual families to ensure that they received the prescriptions that they needed, HFS immediately began to work on a broader solution. HFS called a meeting with the CEOs of all of the managed care plans to explain that they had youth that needed to be covered and that we would give them a corrected list of those youth immediately, which would transfer electronically by close of the business day, and that they were to cover services for those youth starting on February 1st, and all of the plans agreed. Youth Care continued to work with individual parents and agreed to cover services for youth even if those youth had selected a different plan. We all share the goal of wanting appropriate services for these youth. We also hosted a call this morning with a group of adoptive parents that were concerned about this situation, and we will continue to communicate directly with families and with stakeholders as we work to fully resolve this issue. Beyond this, we are committed to setting up consistent and streamlined communication with the Cook County Public Guardian, who has been very diligent in raising issues about this process that are important for us to address. We've met with the office on multiple occasions, as was stated earlier, to address their concerns and questions, and are also working on a more consistent communication with that office. The office's leadership has my personal cell phone number, and if they need to escalate a pressing issue, we will have regular meetings with the Public Guardian in addition to regular meetings with the ACLU that have already been established. I'd like to take a few minutes to discuss the youth care program in a bit more depth to address some of the questions that have been previously raised. I want to clarify the two populations that are going into youth care. They are the former youth in care and the DCFS youth in care. To clarify how we define these populations, the former youth in care include youth under the age of 21 who have been adopted, who are under subsidized guardianship, who emancipated from DCFS, or who have been reunified with their families in the previous 12 months. These former youth in care were enrolled in the Youth Care Managed Plan on February 1st, and they have 90 days to select a different managed care plan if they so choose. DCFS youth in care include those youth who are under the age of 21 and under the legal custody or guardianship of DCFS. They are scheduled to be enrolled, as was stated previously, in April 1st. And the DCFS guardianship administrator can select another plan for a DCFS youth in care. So very quickly, I want to go through a program overview so that we can kind of understand the overall program that is going to be put in place. It's grounded in a 4-pronged approach: care coordination, training, psychotropic medication oversight, and community partnerships. Care coordination has been tailored for the youth in this program. Youth receive a health risk screening that identifies the level of health care needs for the youth. Each youth is then placed into one of 4 separate categories to best meet that youth's specific health care needs: complex, high, medium, and low, based upon their current needs. Youth who have the highest health care needs then receive a health risk assessment that further identifies health care needs that are assigned to a health care coordinator who specializes in either physical or behavioral health, depending on which is more pressing for the youth. For youth who are hospitalized, youth care is required to work with the hospital and others to begin discharge planning at the time the youth is admitted to the hospital, not waiting until it is time for the youth to be discharged. Working with caseworkers to identify what services are needed to assist a youth to stabilize in a foster home or other less restrictive setting. Youth care also brings added training resources to providers that specifically focus on understanding and addressing the trauma that youth in care have experienced. They have the ability to bring nationally recognized evidence-based training to providers in Illinois. Specifically, they have trainers for trauma-focused cognitive behavioral therapy, for parent-child interaction therapy, for child-adult relationship enhancement, and components for enhancing clinical experience and reducing trauma. They also offer this type of training to foster and adoptive parents to help them understand and interact with their youth in a more productive manner. For youth in care, the healthcare coordinator helps the youth and their child and family team in the completion of an individualized plan of care. That plan of care is used to support the goals and services in the DCFS service plan to ensure that the youth has access to all of the services and supports that they need to meet their permanency goal. All of this is done in collaboration with the caseworker and the child and family team to ensure a coordinated and cohesive health care plan for youth and to ensure that the youth has access to health care services required to meet their needs. Also for youth in care, Youth Care has established a new health care record system to ensure that when DCFS youth move to other locations in the state, their health care information will follow them, will be accessible by their new caseworker or placement agency, and a coordinated network of providers will be available to offer them services immediately. Specific new programs have been developed for youth who are preparing to transition to adult services, called Little A to Big A, adolescent to adult, and for youth who have been or are in the process of being adopted, called Promoting Adoption Success. Youth Care works with national organization, one particularly called Attach, that offers ongoing support groups and trainings for adoptive families to help them work through the many rewards and challenges that adoption brings. Youth Care also has specific programming for LGBTQ youth to ensure that they are receiving services in a supportive and affirming environment. All of these services that Youth Care brings are necessary to enhance the overall healthcare system for these particularly vulnerable and traumatized youth. I want to discuss a little bit of the implementation process that we have used. HFS and DCFS have implemented a full communication process to engage directly with those most impacted by this transition and advocates and stakeholders across the state. This has included more than 50 town hall meetings, more than 10 child welfare managed care implementation advisory work group meetings with providers, advocacy groups, and other stakeholders. In addition, HFS, DCFS, and Youth Care have ongoing meetings with foster care and adoption advisory councils and foster parent support groups, as well as ongoing meetings with DCFS foster care, residential providers, and provider associations. Furthermore, HFS and Youth Care will have regularly scheduled meetings with the Foster Youth Alumni Association and other stakeholder groups that need additional information about the Youth Care program. HFS, DCFS, and Youth Care have also conducted meetings and conference calls with individual parents and foster parents to troubleshoot issues, to identify barriers, and to improve the overall process. We have been and remain absolutely committed to listening and responding to any issues or concerns as they arise. We recognize that we can always do more. and that there will still be foster parents, adoptive parents, and former youth in care who have not been able to, we've not been able to reach through our process so far. That is part of the reason that we implemented the rapid response process that, again, can be accessed through the Youth Care website, via phone, I'll say it again, 844-289-2264, or via email at ilyouthcare@centene.com.
Ms. Herman, I'm going to ask if, just because we are going to be leaving this room at noon, that perhaps your colleague, Ms. Garrett, would like to have an opportunity to testify, and then we still have DCFS, and I know there are a lot of questions here. So I don't want to cut you off. I know you have a lot to share, but I am watching the clock a little bit today. So if you could wrap up and hand the baton off.
There we go. So if I may, Ms. Herman actually would cover what I would cover, so it might be simpler to just have her continue. Okay?
Thank you.
The Chairwoman, I will move ahead in my remarks. Okay. I want to talk quickly about oversight and monitoring because this is incredibly important. We take the oversight and auditing of our managed care plans very seriously. HFS's independent external quality review organization, which is used by agencies throughout the nation, has been conducting multiple readiness reviews of youth care's policies, procedures, staffing levels, and the provider network adequacy. It's HSAG, the Health Services Advisory Group, national organization. We are required federally to have an external quality review organization to oversee our plans. So it's a trust and verify arrangement. They go out and do audits. They did several readiness reviews for youth care. So any deficient areas are required to be addressed immediately and prior to enrollment of individuals in the plan. Youth care has been determined to be in substantial compliance, allowing former youth in care to be enrolled. There's additional oversight and monitoring that's occurring related to the youth care process. When youth care completes a health risk screening for DCFS youth, it yields a stratification level. Youth that are identified as low or moderate are sent directly to DCFS clinical leadership for review. If they request a different tiering, then that is honored and that child is moved up. Let me address very quickly, and then I promise to be brief, the provider network adequacy. There's been an immense amount of focus on the provider network. So we'd like to discuss that in some detail. Developing the provider network is an ongoing process that will continue throughout the implementation of the youth care program. Youth care now has contracts in place with 97% of the highest utilized DCFS providers. And important to note, the overall number of providers who will serve DCFS youth and former youth in care has already significantly increased through Youth Care's network. We currently have approximately 83% more providers that are now able to serve DCFS youth in the DCFS network. In every provider category, such as hospitals, PCPs, behavioral health, dentistry, and vision, Youth Care Network surpasses the number of providers that were in DCFS's existing network. Additional providers, including large hospital systems, have agreed to contract with Youth Care once the go-live date occurs, and we have commitments from several of those large organizations. Youth Care has been actively working with administrations at these hospitals to inform the practitioners and the business offices that the practice will be participating in youth care and that they should treat all DCFS former youth in care coming in for services. Youth Care currently meets time and distance standards for all categories except for some like cardiothoracic surgery, hematology, and others that I can share with you later. I'm sorry?
Ms. Herman, I'm so sorry, but I am going to ask DCFS to come up and then there will be an opportunity for you to come back to the table and address some of the questions that I know members have.
Okay, thank you so much, Chairwoman.
Okay, thank you.
Good morning, Senator Morrison. I appreciate that we have limited time, and HFS provided very comprehensive remarks, so we are going to be very brief so we can get to questions. Thank you, Christine, for those opening remarks, and thank you to the ACLU and the Office of the Public Guardian for sharing.
And would you please identify yourselves for the
Yes,
record?
of
Thank you.
course. Hi, I'm Jamie Dornfeld, Special Assistant to the Director at DCFS.
Jason Strokosh, DCFS.
Chairwoman Staines, Chairwoman Morrison, and Spokesman Severson, members of the Special Committee on Oversight of Medicaid Managed Care, members of the Senate Human Services Committee, thank you for asking us here today to testify on behalf of the Department of Children and Family Services on this important topic. As I mentioned, I'm Jamie Dornfeld, Special Assistant to the Director and Manager of DCFS's Transition to Managed Care. I'm joined by Jason Strokosh, our Chief of Communications. I know each of you shares our commitment to creating brighter futures for the most vulnerable children of Illinois. We appreciate your ongoing efforts to collaborate with DCFS and to work in partnership with us as we fulfill our mission to keep children safe and to strengthen families. DCFS is committed to ensuring our vulnerable children and families receive quality health care. Current and former youth in care are among the most vulnerable in our state, often facing complex and challenging needs. We are working closely with HFS as they make significant progress building out the youth care network of doctors, hospitals, and other providers to give our kids the health care they are entitled to. DCFS is committed to supporting our families and ensuring that when managed care is fully implemented, our children will receive a level of care and access to crucial services that do not exist today. Specially trained care coordinators will work closely with child welfare caseworkers and foster and adoptive families to better serve the needs of our youth. This new service hasn't been available to the child welfare system in Illinois before and will be key to offering whole person health care to meet the behavioral and physical health needs of the children. The transition into managed care for youth and former youth in care is complex, and we know families have questions. But we are deeply committed to supporting the families we serve and helping them understand the process. As Christine mentioned, we have engaged hundreds of stakeholders to actively help with the transition, including caregivers and parents, child welfare providers, physicians, advocates, and countless other partners across Illinois. We hosted town hall discussions, sessions with provider associations and family support councils, direct contact with parents and guardians, webinars, and more. Even with these efforts, we know there will still be questions about the change. DCFS is committed to staying engaged with our partners and continuing our extensive outreach efforts across the state beyond the April 1st transition date. We have made significant progress over the past few months, and I'm incredibly proud of the efforts of our entire team at DCFS. But we have more to do, and we will continue to move forward with urgency. We owe this to our state's most vulnerable children and to the loving families that open their homes to help us care for them. We are committed to continue to review our work with you today and partnering with you to do the work better. Together, we can build a coordinated, whole-person healthcare network our vulnerable children deserve. Thank you again for asking us here to testify today.
Does that conclude DCFS's initial remarks, or can we
It
go to
does.
questions?
You can go
Okay,
to questions.
Thank you. Senator Staines.
Right, maybe HFS should come up as well as DCFS, because I suspect between the two of you, I'm not quite sure who will need to answer the questions. Let me start with just big picture. Who is now running the youth care program? It's been really hard to follow all the sales between the insurance companies of who's actually running it and what's happened to the management of it, where it resides.
So the youth care program is a standalone program. It was underneath Illini Care. It is now underneath Meridian. So that transition has occurred. They are now underneath the Meridian umbrella.
Okay, so have the personnel changed who are managing it, or have they stayed in place?
So thankfully, we have maintained the youth care management team. They have been consistent, so they are still in place.
All right, so it's officially part of
Meridian.
and
Meridian,
is
yes.
managing and will be held accountable for the performance of the plan.
Yes.
And who does, so I know when a youth comes into care, they have to have a screening within 24 hours. Who currently, prior to going to youth care, who's been doing those screenings, and who will do those screenings once the transition to youth care has been fully implemented?
So that is done through the HealthWorks program, and HealthWorks lead agencies sort of take the lead on that. All 19 of those lead agencies have been brought into contract with youth care. So that process has been maintained, and it'll continue through the youth care program.
So that's staying intact?
Stays
that's not
intact.
Changing?
Yes, yes.
And, okay, and I also understand, I believe, that once the implementation happens, that for some period of time, all current providers that those youth are seeing will continue to be able to see those youth, even if they're not part of the network. Is that correct? I think for 6 months, if I'm understanding that correctly?
It's absolutely correct. And for former youth in care and youth in care, it'll run to September 30th. So it's called the continuity of care period. Any provider, whether in network or not, that does a Medicaid covered service for a child will be paid through youth care. During that time, they are going to work to bring them either under a single case agreement or into network.
And if those agreements can't get worked out after that September 1st, I think you said?
30th, I'm
30th,
sorry.
excuse me,
Yes.
September 30th, I'm sure that was me. September 30th, after that period of time, then they would have to find a new provider if some agreement has not been worked out.
If it looks like an agreement cannot be worked out, they will find another provider for that individual. But we are confident that 99.9% of providers are going to agree to a single case agreement or come into network. But we will ensure that children receive continued services.
And what happens if court orders a service that is not necessarily covered by Medicaid? I mean, I know there's situations where that happens too. So if that's not covered, that's not part of the plan, it's being asked for by somebody who's not part of the network, what happens in those instances for that youth?
So that would be covered by DCFS. Court-ordered services will be covered regardless. If they are Medicaid-covered services, they will go through youth care. If they are not, they will go through DCFS. We will ensure that they're covered.
All right. So, and when we go to integrated health homes, I know there's a lot of discussion about that, and there's probably some of those health homes might, what's the overlap here with the youth in care? Are they going to be then assigned to an integrated health home? How's that, is there going to be another transition for these youth once that happens? What is the rollout plan or coordination there?
Integrated health homes are going to provide a very intensive level of care coordination called high fidelity wraparound and intensive care coordination. Those are set to launch probably mid-year. We are going to work really carefully with DCFS on that transition. Managed care sort of lays the foundation because they are going to organize the network of integrated health homes. And then we will work really carefully with DCFS to make sure that the transition of any DCFS youth that meets the criteria for an integrated health home is done very smoothly. So I would say that there's more conversation that needs to happen on that particular effort.
But you are saying that these youth may transition in April and then may have to transition again in the summer.
If they meet the level of criteria to receive services in an integrated health home, we'll work with DCFS to figure out that transition. So the answer is yes. I mean, it's a simple yes. I just wanted to be clear that we have a lot of conversation about making sure that's a smooth process with DCFS.
Well, okay, and what is the current, and I want to let, what is the current status of those 2,500 youth that were not enrolled in if they selected others? Are they all enrolled at this point and able to get service? I know you were handling it sounded like through a one-off basis where somebody called and got to you, but you know, a lot of those folks, I'm sure not all 2,500 of those have made a phone call or initiated some concern.
Yeah, let me reiterate the process because it's really important. The plans have received a list of all 2,500 individuals, and so they know who those individuals are now. And if one of those individuals attempts to get services and the service provider says you're not in the system, they can call the plan can look them up, talk to the provider and say this service will be covered. That's today. Hopefully by close of business today, they are going to get an automated list that they can load into their programs, and then I think by the end of the week, those individuals will show as enrolled in their program. So we're having the one-offs, absolutely. We're talking to people, we're walking them through it. I had a conference call with foster parents and adoptive parents this morning to walk them through it, but there's also a systematic approach in place.
Honestly, why wasn't that done before the transition?
It's a very fair question, and it was a system issue that we identified on Sunday.
And how about now when the youth in care, they also are going to have the choice of opting not to go into the youth care program, but to select another MCO? Will this same issue occur with them as well?
I can say this issue will be addressed fully before that time. So no, this issue will not occur.
Right, so obviously the goal of this is that ultimately we're going to improve care for kids. At this point, it sounds like it's, that obviously transitions are always challenging, and we know that, and there's always going to be some problems in those transitions. What information and reports, what are you going to be holding the youth care plan, now owned by Meridian, accountable for? What will look like success to you a year out? What are the specific quality outcomes that you're going to be holding them accountable for? How's that going to work? And what's your statement to us that we're actually going to see improved care for the kids in DCFS system?
So there's very specific outcome measures that we have for this population. All of the plans have a long list of HEDIS measures to improve quality outcomes for healthcare. For this particular population, I have the specific list if you want me to address it. It's in the transition plan. We are expecting them to reduce hospitalizations. We're expecting them to improve school performance. We're expecting them to have fewer contacts with juvenile justice. We are expecting to see improved performance on the Illinois Medicaid Comprehensive Assessment of Needs and Strengths, which tells us like the specific functional areas that these individuals are improving on. We're expecting them to help with the permanency goals. So we're not just looking at this in terms of improved level of immunization and your basic physical health care. That is extraordinarily important and part of this plan. But we've really put in measures to say, how are you going to impact this child's overall functioning for the better? How are we going to ensure that they're improving in really meaningful areas of their lives? And how are we going to support them towards getting to a permanent arrangement, subsidized guardianship, adoption, or reunification with their family if they are youth in care? For former youth in care, how are we going to make sure that that adoption is sustained and supported? Those are really the broad goals of this program.
And will you have your reports that will be publicly provided to show actual progress against those specific goals?
Yeah, absolutely. And our external EQRO HSAG is going to be doing the outcome reporting for that. So again, it's a verified report. It's not just taking somebody's word for it. And those will be done on a regular basis.
Senator Gillespie.
Hi, thanks. I'm going to dig into some operational questions to try to get to how exactly these problems are going to get fixed.
Okay.
So with regard to the systems problems that you had, the pharmacy one you mentioned and any of the other ones, are you and Meridian working on root cause analyses, or how exactly are you digging into identifying what the cause of this were? And how are you going to roll that into your implementations in April?
Excellent question. I have to give you a non-technical answer because I'm not a technical person. But immediately...
Well, if you have anybody here that can answer that.
Yeah, I can answer it
Okay.
at the higher level. On Sunday, the issue was identified, and Tracy called me. We started immediately problem solving this issue and identified that it had something to do with eligibility. Monday morning, I got with my eligibility folks within our Bureau of Managed Care, and they started going through the programming and figuring out that would be the root cause analysis. They looked into the programming to see what happened, and they literally found the portion of the programming where the code didn't work right. I apologize, non-technical. and immediately put in place the fix that needed to occur. Then we identified who the individuals were. We got those on a list. We got those out to the plans. We called the plans. We had the meeting with them, and then identified the ongoing systematic fix that needed to happen. So that root cause analysis and solution happened very quickly.
Okay. So as you know, with any kind of systems issue, you can go in and fix a particular problem, and without regression testing, you can very easily create new problems as a result of whatever fix you put in. So are you doing regression testing or something similar between now and April to ensure nothing else got broken in the process?
I will say that we are looking at the system. I don't know that's a formal regression test, but we're definitely looking through all of the various areas to make sure that this problem does not persist.
Okay. I would strongly urge you to do that, to make sure we don't have a repeat or a new problem come April.
Completely agree. Thank you.
The second operational question, great news about some of the expansion of the networks under MCO compared to fee-for-service, but are there pockets of network weakness? Because we are hearing from previous testimony and from constituents that there are providers that aren't in the network. Have you identified pockets of weakness, either by provider type or geographic? And what are we doing to resolve that?
So the time and distance analysis did show that there were some areas of the state where there's not enough specialists. So we need to identify if there are specialists in that area. And we know that there are some areas of the state where there are not, or if there are specialists in that area, to bring them into network. We also instituted the continuity of care period so that we could identify any of those providers that were not already in network and bring them into network. We also have a couple of very large hospital systems that have agreed to sign after go live. So they were waiting to make sure that this was actually going to move, and they have committed to signing. So that is going to fill a lot of those areas where we've seen some provider issues.
Okay. And are you doing this work, or is Meridian doing this work?
Youth care, well, it's kind of in tandem. There have been some situations where they've called and said, we need some assistance with a provider, and HFS is happy to help in that situation. But youth care is doing the outreach, and I will say they've had some really good success with some providers that have said, no, we don't want to join, who have then come in to agree to do a single case agreement.
Okay. But per the agreement with ACLU and the court, we're going to be adding a second statewide MCO to the youth care program for Current. What's the process going to be for doing that?
So what we've done is the Guardian has the choice of any of the plans. So all of the plans are prepared to accept a DCFS youth in care.
Okay.
We've done the contract work that needs to be done for that, and we've discussed it with the plans.
Okay, so it'll be the same full MCO network
Yes,
for all of youth in care?
yes.
Okay, thank you.
Senator Kaler.
Thank you. I hardly know where to start on this. I don't doubt that all the staff and all the departments are really working hard to resolve this issue. I think that the problem probably more lies with us as policymakers. You know, we've gone into a system that I don't think is really going to work. And so I guess my question would be, after I vent a little bit here, I guess, is what do we do when we come up against the next set of problems? I mean, why is it that we're putting all of our eggs into the basket of the MCOs? I can tell you horror stories in my own area about, you know, whether it's Meridian or you know, whoever. I mean, it just goes on and on and on. So at some point, and I guess it's really directed to ourselves, let's talk about the issue of what should the policy be, and not keep, you know, questioning staff about how to implement it. I think that it's a flawed policy, and I think that we're going to see this time and time again until we finally figure out that this doesn't work, and let's get on to do something that does work. I mean, all we're talking about here is providing appropriate care for very vulnerable people and doing it well and making sure they don't slip out of the system. And when you provide appropriate care, it usually is better cost effective because you're not utilizing services. I mean, that's what this is all about. And when do we ever get to that discussion about really addressing the issue of what should we be doing? It's not whether we're doing things right. Are we doing the right things? That's my frustration.
Senator Ryder.
Thank you, Madam Chair. I am really actually glad that Senator Kaler went right before me, because, and the reason is for those of you who have not been around for more than 3 years, Senator Kaler has been on one side of this issue, and I've been on the other side of this issue since we started. He has, like he just did, basically said, you know what, this system doesn't work, let's scrap it and move on to something else. And I've always been over here saying, no, 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 no. The concept of managing care can make people healthier and in the long run save money. So let's figure out how to do it. And I feel like in that tug and war between he and I'm getting shellacked right now. I believe in that concept, but like all concepts that are supposed to take you from here to there, it's about the execution that gets you there. And there was a question that was actually asked by my colleague Senator Staines a moment ago that completely crystallized that. The question was, you, Ms. Garrett, had laid out some procedure or process, and Senator Staines' response to that was, that sounds like something that should have been done before. Why wasn't it done before? And your answer was, that's a good question, and it's a system issue. What does that mean? System issue. That's the answer you gave. What does that mean?
So I think you're referring to the programming piece that unfortunately removed the former youth and care from the plans that they had selected into a status that looked like they were not eligible for services.
Okay. You understand and I think you do from your answer about, well, that's a good question, is that we, the members of the committee, I think repeatedly believe we hear things in response to crises that were the things that should have been placed before we had the hearing. And so, and this is a question for both the agencies, is, are we missing something? I mean, in other words, in terms of the processes, and I listened very carefully to what you had to say about what we're going to do between now and April. Is that going to cover it for us? Because what I don't want, and I don't think any of the members of the committee want, even Senator Kaler, is for us to be back here in the second week of May having this same hearing, asking these same questions. And so do you think the processes that you've laid out are really going to resolve this issue?
I believe that this process will resolve this issue, and I believe we'll be looking very carefully to make sure that it does not happen again.
We can't run the system. This group is not either legally empowered to run the system. No, I don't think we're capable, not because of competence. We're not in those positions. But what can we do? What can the General Assembly do? And I'm asking that question of you and not the director for a very specific reason. What is it that the General Assembly can change to make this easier for you, make you better capable of getting done what you want to get done?
So I very much appreciate that question, and I don't have a ready answer for you, but I would like to get one.
I would love that. And going forward, that's a question. You should never be shy about saying we need the General Assembly to do A or B or C. Because I think, and this is not particular to this group, this General Assembly, but sometimes we think we know. Or if we don't hear anything, then we think, well, everything's okay. And then we have a hearing like this, and we hear Ms. Gomez from the Cook County Public Guardians get up and say some unbelievable things that are bad. Okay, I appreciate, I mean, I know this is a tough issue. I know this is a difficult issue. I will end on this. Even listening to the testimony today, which has been articulated well, there are still people up here on this committee thinking, okay, who's running this? Who's in charge? It is, and I don't think it's because we don't get processes or frameworks or flow charts. I think there is a very real concern here that there are different areas of responsibility, and it is difficult to find out when something goes wrong within that area who you're supposed to go to. I think that is a foundational problem in this system right now. So with that, thank you very much. Thank you, Madam Chair.
Senator Feigenholz.
Thank you, Madam Chair. It's sort of a mic drop moment when Senator Ryder says what he has said. I've been working with him for a long time, and I couldn't agree with him more that we have to sort of step back and take a look at what, and Ms. Herman, you and I have known each other a long time, what's going on and how we're designing this. We have a convergence of consent decrees, BH, NB. We have the opportunity through Family First to really sort of shift the philosophy of how we take care of youth in this state with Family First by keeping them out of DCFS. And there doesn't seem to be a comprehensive conversation going on. It does seem sort of chopped up and bifurcated, and it's creating a great deal of confusion, not only for consumers, but also everyone up here. And we hear about it. Our constituents call us, providers call us, we hear harrowing stories. And I have a few questions. First of all, Meridian is now taking over this contract. Have they signed a contract already?
Sorry, I need to look at Robert to answer that. I believe the answer is yes.
Is that posted publicly on a website somewhere that we could see it?
I'm sorry, Senator, the Meridian contract or the youth care contract? I'm sorry.
Well, there is you have another provider outside of Illini Care that's taking over one of these contracts, correct?
Correct.
Is it public?
Yes. Yeah. Robert would like to fully respond.
Terrific. When Ms. Gomez was up sitting here, she talked about the lack of availability of feeding tubes. I thought all medically fragile, technology-dependent children were not in this program. Is that accurate?
Do you want to answer the contract first?
Okay. Let me answer the contract question first.
Great.
So there is a separate contract for just youth care that was signed by then Illini Care, that was assigned over to Meridian, which is the remaining Centene company. So it's a separate, distinct contract, and I'm not sure it is on the website, but we can make sure that it is. In addition, Meridian also has a health choice contract that all the other MCOs have as well, that we've also added amendments so that for the requirements for them to treat the youth in care when that becomes effective.
Can you answer the medically fragile question?
Yes. So there are a couple of populations that are excluded. That's kids that are on the medically fragile, technology-dependent or trach-dependent waiver. And then youth that were assigned for in-home nursing. But there are other medically complex kids that don't fall into those waivers that were enrolled in the plan. And the issue that we had with the supplies was related to that system issue that we discussed earlier. So there are some medically complex kids that aren't in the waivers that are in the plan.
Could you tell me why they're not in the waiver?
I believe that those children didn't meet criteria for the waiver, but not my area of expertise, so I would need somebody else to address that more fully. I'm sorry, Senator.
Well, I'd like to know a little bit
Sure.
more detail about it because these are the calls we don't want to get.
Sure.
I have a couple more questions about the process.
Mhm.
So, did Illini Care, when they were trying to identify youth, did they have quotas for their workers completing health screenings?
I'm not aware of that.
Is that yes or no?
I'm not aware of them establishing quotas for their staff.
And also, a little further back,
I'm sorry, Senator, I so apologize. The answer is no.
they did not have to meet
They
any
did not.
criteria. Okay.
No.
And your population went from 15,000 to 12,000. What was that drop? Your universe of youth seemed to have gone down. Is that because you took MFTD out? Is it because of opt-out? Is it because you couldn't find some of the youth?
I'm sorry, Senator, from 15 to 12, I'm not.
12,000 youth.
Can you give me some more context for those numbers? I apologize.
So your charge, Illini Care's charge was to identify the population of youth, correct? You had to
Yes.
find,
So,
they had
okay.
to do an outreach to find where these kids were.
Correct. So I think the issue may be of the list that they received. They found that some had been reunified, some had emancipated, some had left the system. I believe that is what the difference in the numbers was.
That's a lot.
So
Maybe Jason
yeah, I
knows
have
the
Tracy
answer.
who I think can answer that more thoroughly if you want to bring her up.
Sure. Because I'm seeing some
Okay.
data that there were 17,000 youth originally estimated
Okay.
to be, and it was down to 2,000. So I'm wondering what happens to the lost.
Okay, so
Can you
we've-
identify yourself for us, please?
I am Dr. Tracy Johnson. I'm the youth care lead with Centene, who has been developing and implementing this plan since 2017. Thank you. That's actually a really good question, and I can answer that. So again, we did a soft launch. So this was not a go live. This was a begin care coordination. And that was for a 3-month time period beginning November 1. So for November, December, and January. When it was postponed to February, the idea was let's go ahead and start gathering this information. We received the Medicaid and DCFS enrollments as of November 1. It was 16,602 children. We've been saying about 17,000. That's what we've been planning for, but it was actually 16,602. Now, during those 3 months, as we called, some of those children had been adopted. Some had aged out of the system. Some, they said, had gone back to biological parents, and/or they didn't show up in our data feed. Maybe, something else had happened. We did not have them as of November 1. So for 3 months, we worked off November 1 data because we're not live. That was just a soft launch, let's test. So as we went through and we made almost 40,000 calls to all 16,000, plus we had a lot of duplicates. So we actually probably had about 18,000 that we called. We did about 40,000 outbound calls in these 3 months. And as we had a youth and whoever we called said that child's been adopted or they turned 21, we put them on a list. And so our 16,602 has decreased over the 3 months period. Now, of course, when we go live with that population, that is youth in care on 4/1, we'll get data every day. So it won't be just a static list that we're working off of that's a couple of months old. We'll have that information and those numbers will change daily and should be consistent.
So the reason is because you haven't gone live?
Correct.
Okay. Because I was wondering how you're going to figure out, who's in what plan and if they've aged out, et cetera. So your provider network is of great concern to a lot of us, and you seem to have gotten a lot of doctors in the system very quickly. Is that accurate?
Yes, well, when we went into this, we had a Medicaid network that served children. And so last year, we worked an outreach to a lot of those providers and said, at some point, we are going to be implementing a DCFS initiative that's going to focus on these kids. Would you like to serve the DCFS population as well? Our goal has always been to get more providers than we're currently serving the DCFS population. So we were able to bring in many providers from the Medicaid population to the Youth Care Network. We're also working on the DCFS network, bringing all those in. And we've been actually able to add some other providers by doing youth care only contracts, where they say, we don't want to work with managed care, that sort of thing. Will you work with this specialty plan? Yes, so we've done youth care only contracts with these providers.
Somebody told me that instead of you counting a provider group or a physician group, you've counted individual physicians. Is that accurate?
It depends on how they are credentialed and impact with the state, and I think Christine can talk to that, but if we say Springfield Clinic, I count that as one. You know, that they have 600 PCPs that serve multiple counties, so when I look at it at a county level, I can look at where those PCPs are in the county and I can count it that way. So it just depends on how they contract.
So if after, the 6-month contract that you're going to execute with these individuals who are our primary PCPs, what percentage of them don't want to stay in the plan? Are you auditing the doctors that refuse to sign the contract? Because I think that in the first hearing we had in Chicago, remember that one?
I do.
We asked, there were a lot of concerns from legislators about the consistency of and breaking the relationship that their children have with their physicians. And I think that this is going to be a huge issue for all of us back here. And so I think it's important for us, are you auditing that? Can you report back to us?
Absolutely. So first of all, for what went live, the former Youth in Care that went live on 2/1, we have an 8-month at this point in time continuity of care, which we're explaining to providers. That means open network. There is no par, non-par. You bill us, we will pay. If you want a single case agreement for that particular child, we will do that. We did one yesterday with SLU Care in Cardinal Glennon for a child who could have their tonsils removed. We are in our list of Medicaid providers in the DCFS list, and any other ones we hear, for example, ABC Pediatric Therapy downstate that does a lot of OT, said no. They were telling their families, we're not sure what this is, we don't take Illini care, we won't see you after February 1st. I called, our network folks called, we had a meeting with the owner of that organization, we explained how it worked, we talked about MCO strategies, we changed our contract to reflect some of the things that she had concerns with, and now they are going to sign. And so she has been outreaching to all those families before that she had said, no, we're not going to do it, to say, we are going to do it. Until we know who they are, that doesn't give us the opportunity to go and to meet with them and sit down and talk to them and say, this is what we can do, this is what youth care is. For the larger facilities, we know that a lot of business offices are getting them. Sometimes we need to talk to the CEO. Maybe we need to talk to the medical director. And we are, everybody who says no, declines, we have a list, and we are leveraging partnerships through some partner organizations across the state.
Do you think you'll be able to do all of that for every child in care by April 1st?
Well, I don't know that we need to do that by April 1st because continuity of care. So it is not, if they're not in network as of 2/1 or 4/1, they cannot be seen. There's continuity of care, which is a process of, hey, we're going to work with you, we've gone live, who are your doctors? We'll get them into network. If they don't want to come into network, that's totally fine. We will ask them to do a single contract for that child. And right now,
for how long though?
Right now, we've said till October 1st, and we'll reevaluate it as it gets closer.
Senator Feigenholz,
so-
I'm gonna ask if you can hold the rest of your questions.
Of
We have
course,
several other
thank you.
members. Senator Menard.
Thank you, Madam Chair, and thank you for allowing me to sit in on the joint hearing and asking a few questions. I want to pick up where Senator Kaler left off and ask if either, and I guess part of my confusion is, do I pose this question to DCFS or HFS in terms of cost containment? Is one of the goals of this transition to contain costs?
I can unequivocally say that the goal is better clinical outcomes.
Not cost containment.
There is no expectation of cost savings.
Okay,
That-
so Senator Ryder isn't here. I guess maybe I shouldn't invoke his comments, but I believe he said something along the lines of, and this goes to Senator Kaler's line of question, that part of the goal of managed care was to contain costs.
So I just want to be very clear. When we're talking about containing costs, we want better care. And if better care means that we are being more efficient, then that is great. But it is not the goal for cost savings for this program. We're actually making more investments in the care for these kids. Now, we do believe that through coordination, through provider networks, that we will realize better care, that we can reduce hospitalizations, reinvest in community services.
So
I mean, that is ultimately the goal.
So is there a expectation, or is there, has the department determined what the cost of these contracts is going to be in fiscal year 21, which would be the first year that the contracts would be annualized for 12 months? Is there a determination of what that cost is?
I would defer to Robert, but I'm sure that there is. I'm sorry, it's just not my area.
And I guess a
In terms of
follow-up is,
Contract
I would be
costs.
curious as to what
Sure.
that cost is compared to what it has been. And Robert, I'm assuming this is all in your budget, right? This is all in,
It actually is not in my budget. I am responsible for managing the MCOs. My name is Robert
Okay.
Mendonça, Deputy Administrator.
so this is in
HFS.
DCFS's budget?
Well, the Medicaid portion would be in HFS budget,
Okay.
and then whatever non-Medicaid portion would be remaining in DCFS budget. I do not have those numbers. We could absolutely get those for you. I will tell you that the rate that was developed to pay youth care had no managed care savings incorporated into it at all.
Okay. So is it going to be more expensive or cheaper?
The intent is that it would not be either, that we would continue.
Well, it's got to be
paying-
one or the other. So, I mean, and I'm not, this isn't a gotcha thing. It's, to Senator Kaler's point, we've had this debate for years in this room, mostly in front of the Appropriations Committee about the pluses and minuses of managed care. And consistently, this is the first time I've ever heard from a state agency that containing costs is not a goal, if that's what you're telling me. So, and this isn't so much directed at the folks sitting at the table, it should be directed to everybody in this room. We should have a discussion about whether or not this is an appropriate policy for the state moving forward. You know, we had a discussion here about a year ago with HFS, might have been 2 years ago now. There were several months where dozens of women were unable to find prenatal care because of the transition to managed care in Macon County. Dozens of women went months and months without medical care because of a transition to something that we have all said is going to make the state better and serve the people that we're charged with serving better. And I think, just my observation of some of the testimony that was given, I think we're in that same position again. And I don't lay that all at your at your doorsteps. I mean, this is a policy decision that we've made as a state, and this selling point of ubiquitous accountability. I mean, that's what we hear from managed care: is it's more accountable, it's going to contain the costs, it's going to raise the outcomes. It's been everything but that. The accountability is completely absent. From my perspective as a legislator, I use the Macon County, the Decatur example. Here we have this transition, And to Senator Feigenholz's question about Centene or whoever Centene was or is, and whether it's DCFS or HFS, there's no accountability here. And I think we all have to look at that. We have to look at that. And I appreciate the answers from the department, and I appreciate the fact that we have the opportunity to have this larger, not just this challenge discussion about what's happening at DCFS today, but the larger discussion that I think we have to have. And I know we're pressed on time, so I probably made more of a point than a question. But I think we should have this discussion about where this managed care movement in Illinois is headed. In my opinion, to be clear, it's headed in the wrong direction. Thank you.
Thank you, Senator Menard. Senator Severson.
Thank you. A couple questions. First, on the from the network adequacy issue, that's currently being you're currently trying to address that for this population, and how is that going throughout the state? Are you having issues in certain parts of the state that we would normally see problems with?
So we've done a detailed analysis, and we've identified areas in the state where we are simply lacking specialists because they don't exist in those areas. That's a broader problem than just managed care.
I was just going to say that's the same problem you're having with even under the old traditional fee-for-service.
All of it, yes.
Okay.
Right. Correct.
And in those cases where that's occurring, do you still offer other types of programs, whether it's telemed or other abilities to get that care, even though it may be outside that particular service area?
Yes, we're implementing multiple methods to try to make sure that people have access to those services as close to where they are as possible.
And with this specialty program for youth and care, you're trying to get a network of subspecialists that are dealing in adolescent issues or psych issues or mental health or alcohol or drug abuse. So you're trying to build a network of sub-providers that, with a goal that would coordinate all those services together. Does that include services outside the medical services? So in other words, working with wraparound with school district and working with family in the whole gambit?
Yeah, so the goal is to have a very broad, very robust provider network to treat mental health issues, substance abuse issues. One of the things about this program that we're very much looking forward to is that they can bring additional training for providers on trauma-informed services and on doing services specifically for the adolescent population, specific services to support adoptions. So we'll be working to build the network that exists and then also to start raising the clinical expertise of those providers within that network.
Will it be one quarterback of that system or one holder of that, all that information? And is there a way that we're going to be able to track the results of those youth that are in that program?
Absolutely. So Youth Care has their provider network. One of the things that our external quality review organization does is audits that, verifies that those providers are in network, are accepting patients, and then are also monitoring outcomes for each of the individual children that are enrolled in that program and then the population as a whole, so that we can see overall, are we getting those better clinical outcomes that we want to see for this population.
And those individuals that choose to use a different provider, choose to opt out of that program, are the other services still available through that, or how is it going to work with those that are choose not to be in the youth and care program, but choose to keep their current system?
So let's say they choose Blue Cross Blue Shield or Meridian or some other plan. They will still have care coordination services available. They'll still have a broad provider network. The other plans don't have as robust a training program for their providers. So I would say that the ones that are in youth care are going to experience a higher level of service specific to their behavioral health needs, adoption, preservation, and those types of services. They will still be offered services through the other plans.
So the goal of this, if it works the way it's supposed to, a goal of this is really to provide a broader array of services, more quarterbacked, making it easier for people who are in the system to be able to access all these different areas, and then have that quarterbacked and tracked to make sure that in fact it works. So the goal makes sense. I think part of the problem, the frustration, is maybe just the communication of this program and the options that foster parents and others have that they can opt out, or how these programs and services are going to work. So is there a better effort being made to try to improve that communications to the families, and if so, what are those?
Absolutely. Ongoing communication is imperative, and it's happening right now through various committee meetings, work groups. Just this morning, I set up a standing call with adoption advocates and parents. We're going to establish, and they're going to tell me what the frequency is they want to meet. If it's weekly, if it's daily, that's what we will do. And they are adoption advocates who have access to families across the state. So they are going to get the information from the families, and then they're going to get it directly to me and Tracy so that we can better communicate at that level. We are going to continue with all of the work groups that we have, meeting with the foster parent council, the adoption councils. If there are other areas that you suggest that we communicate with, we are more than happy to add that to the plan.
Well, maybe one way you could do, I get some shaking heads from people behind you, that before you leave today, if you could talk with people who are here and who they represent, and make sure that they are part of those same discussions, I think that would be helpful start. And then I don't know if there's a list of groups that you're reaching out to. If you could make that list available of who you're talking to, make that available to this committee as well, so we know who you're reaching out to, so when they call us, we can say, well, you're on the list, or you're not on the list, we can get you added to the list. So if that could get communicated to maybe the chairman, who could distribute out to the committee, that would be helpful, so we know who is getting contacted. But again, before you leave today, if you can make sure any of the groups or individuals that are here that are frustrated by not knowing some of these positive things you're talking about that are going on, if you could make sure that you could communicate with them, or they could know where to get that information, that would be helpful. So
more than happy to do that. Absolutely.
Appreciate your time
Yes,
on this.
Thank you.
Thank you, Senator. I have just a couple quick questions, and if you don't have the answer right now, I hope you'll get back to me. What is the number of youth care health coordinators as of today? How many do you have online today?
I think Tracy can answer that. How many for today?
Today. So can we assume by April 1st that number will have at least doubled, as your population is going to at least double? Can you get back to me on the numbers of, and what the caseload is going to look like for each of those? Who is IDing the medically complex kids?
So DCFS sent over a priority list that included ones that they had identified as medically complex.
So it's DCFS who's doing it?
It's two ways. So we have that sort of pre-identification, and then also when youth care calls to do the health risk screening, that health risk screening goes through all of the potential medical issues that a youth has, and so that would also identify those youth as having multiple medical issues that need to be addressed.
So I have from a recent report that of kids coming into temporary custody of DCFS, the comprehensive health evaluation, which is supposed to be completed in 21 days, that we're only at 61%. And I wonder if you can get back to me and let me know why we're only at 61% in the first 21 days. It's kind of important to know what's wrong with the kids or what's good about the kids that we're caring for. And my last question is, if we thought this system was adequate enough to have our former youth in care engaged in it, but not the kids who are currently in foster care, why are we discriminating? If it's not good enough for one group, why is it good enough for the other?
So there are some additional issues that come when children are in care in terms of the system that they're currently being served in. And I think that there was over an abundance of caution, wanting to make sure that we had a smooth process to make sure that those systems were working together properly. So the former youth in care don't have that full DCFS guardianship piece that comes along with them. So there was just some additional complexities within the DCFS youth in care that we want to make sure are addressed.
And can DCFS succinctly tell me what the guardian administrator role is in this rollout?
So the guardianship administrator, DCFS, is responsible for identifying the medically complex children and also their providers. And then we are working out the process so that she can determine whether they should remain in youth care or whether she should opt them out. And so we're in the process of identifying that process, and that will roll out on April 1st.
And is there an appeal process?
There is.
Okay, so I think the committee would like to see more information on that, please. Because we're out of time, thank you to everyone who participated. And if we're trying to incentivize foster parents to participate in our system, we need to get this figured out and we need to have it right. Thank you. This hearing's adjourned.
The House will be in order. Members will be in their chairs. We shall be led in prayer today by Pastor Chris Harris, who is with Bright Star Church of Chicago in Chicago, Illinois. Pastor Harris is the guest of Representative Buckner. Members and guests are asked to refrain from starting their laptops, turn off all cell phones, and rise for the invocation and the Pledge of Allegiance. Pastor Harris.
Good morning, everyone. Let me say it again. Good morning, everyone.
Good morning.
Thank you to Representative Buckner. And I'm going to ask that if you missed church Sunday, we're going to have a little bit now for 2 minutes. So grab somebody by the hand right now. Make sure it's someone better looking than you are. I see a few of you won't touch anybody. I understand. Hold those hands.
We got it.
That's right. Bow your heads. Let's pray. Dear Heavenly Father, we come to you this morning first and foremost to tell you thank you. Thank you for the love that you have shown and the life that you have graciously given to all of us assembled here today. The mere fact that we are still alive shows that we are all pregnant with possibility. We clearly understand that the earth is yours and the fullness thereof, the world and they that dwell therein. Therefore, Lord, we ask that you would use not only our governor, our lieutenant governor, but this entire body to be faithful stewards over what really belongs to you. Empower these leaders to be sensitive to the needs of the people that they serve, while at the same time being subject to the necessary decisions that they must make to bring effective and systemic change. Make this year and decade more productive and progressive than any other year or decade in the history of the state of Illinois. The very definition of vision is foresight with insight based on hindsight. We ask, therefore, for strength of mind and heart, as well as visionary leadership for every leader and person in the midst and abroad. Father, we are all your children, and you are all of our Father. So we humbly request more child support emotionally, psychologically, physically, and financially. Our country, our state, and cities are in challenging situations, but we know that there is nothing too hard for you. Use these great leaders who create policies to make decisions in this room to come up with creative and sustainable solutions to bring your plan for this great state to pass. Grant these servant leaders wisdom and understanding in their noble pursuit of justice and equality. Give them guidance so they will always be conscious of your presence and will strive to enact laws with honesty and integrity according to your will for this state. May they have wisdom to turn adversity into opportunity. Shake the foundations of the state and transform the hearts and the minds of every citizen and resident. Revive and renew our faith back to a place where we are led by an unwavering God consciousness. In closing, Father, you said, if we ask anything in your name, it shall be done. You've instructed us to speak things that be not as though they were. Now, therefore, we decree and declare that racism, anti-Semitism, hate of all kinds, poverty, and violence will cease and desist immediately and permanently. We decree and declare that strong businesses, entrepreneurship, economic and community development shall flourish throughout the entire state. Father, we are going to continue to say it until we see it, believing by faith that it shall come to pass. So because we're holding our brothers and our sisters, we squeeze favor and peace, safety, health, and wealth into every hand that is being held, not only into the hands of these leaders, but into our communities, our neighborhoods, our blocks, households, and every person in this state. We declare this is a February of faith, favor, finance, and fitness, healthy and happy families. You declare to us, let it be said. So now, Father, we declare to you, let it be so. In the name of Jesus, we pray. Clap your hands and shout amen.
Very nice. Thank you. Thank you. We will be led in the Pledge of Allegiance today by Representative Myers Martin. Roll call for attendance. Leader Harris is recognized to report any excused absences on the Democratic side of the aisle.
Madam Speaker, let the record reflect that there are no excused absences on the Democrat side today.
Representative Spain is recognized to report any excused absences on the Republican side of the aisle.
Thank you, Madam Speaker. Please let the record reflect that Representatives Kiker, Stevens, and Eunice are excused today.
Have all recorded themselves who wish? Mr. Clerk, please take the record. There being 111 members answering the roll call, a quorum is present. Representative Murphy, for what reason do you rise?
Point of personal privilege.
Please proceed.
Madam Speaker, thank you very much. Last Tuesday, there was a plane crash just outside the city limits of Springfield. And soon thereafter, our greatest fears were confirmed that we lost 3 constituents of mine from the 99th District. John Evans, Frank Edwards, Cinda Edwards, and Frank and Cinda's dog, Lily, were all lost in that crash. Frank and Cinda Edwards were lifelong public servants to this area. Frank started his career as a special education math teacher and PE teacher. He was also a member of the Illinois National Guard, and then he joined the Springfield Fire Department, where he served for 25 years, ending up serving as fire chief for Springfield. In 2003, Frank ran for city councilman and served there till 2015. In December of 2010, when our Springfield mayor passed away, Frank was asked to step into the role of mayor. Frank served not as a caretaker, but he made significant changes and improvements to that office. And when he left in April 2011, it was a much better office. His outstanding public service was equally matched by his wife, Cinda. Cinda began as a registered nurse in 1984. She was elected a member of the Lincoln Land Community College Board. And in 2011, when the confidence of our coroner had reached an all-time low, Cinda was asked to step in. She came in 2011, was reelected in 2012, 2016, and was running unopposed for this year, 2020. Her professionalism, her kind and caring ways changed that office dramatically. Like I mentioned, it had lost the confidence of the community, and today the coroner's office is a very professional office that's respected by all members of the community. Frank and Cinda was also small business owners, owning Springfield Auto Body and Towing for the last several years. They had been married for 37 years. They are survived by one son, Alex, and I hope that everyone keeps him in your thoughts and prayers. Frank and Cinda will be missed by their friends, families, and all members of the community. But without a doubt, Springfield and Sangamon County benefited greatly from their lifelong career as public servants. They were dear friends. I will miss them greatly. I know a couple other members would like to speak as well, but I request a moment of silence when we conclude. Thank you, Madam Speaker.
Representative Butler is recognized.
Thank you, Madam Speaker. A point of personal privilege.
Please proceed.
Thank you to Representative Murphy. And, Frank and Cinda were characters, to say the least. Mike did a great job spelling out their careers. I had the opportunity to work with Cinda when she worked for Hospital Sisters Health System, and I was working there as well in her role as a nurse at Priority Care, and have known them for quite a long time. Frank, if you knew Frank, you knew that he was outspoken. He was not afraid to tell you his opinion I dreaded answering his phone calls when he would call me on my cell phone because you knew it was a half-hour conversation about property taxes, probably. But Frank and Cinda were wonderful, wonderful people. I had my car repaired at Springfield Auto Body and Towing by Frank. And I just had a conversation just a few days before they had left for Florida, just a couple days before they left for Florida with Cinda, a lengthy conversation about her work in the coroner's office and our need for a new pathologist because our person had left. And it's heartbreaking to think that was the last time I talked to her, just a few days as they were flying back from Florida. They were stalwarts in this community, and they will definitely be missed. So thank you all for keeping not only the Edwards family, but the Evans family in your prayers.
Representative Brady is recognized.
Thank you, Madam Speaker. Point of personal privilege as well.
Please proceed.
Thank you. Ladies and gentlemen of the House, has been already spoken to by my colleagues here in regards to Frank and Cinda and Mr. Evans, who I did not know, but I did know Frank, and I worked with Cinda. I was not county coroner at the same time she was when I was in McLean County, but she came in here in Sangamon County. And what we worked on mostly together was legislation for the Coroners and Medical Examiners Association in the state to try and professionalize the association through not only education, advanced training, but also through the spirit of cooperation with other law enforcement agencies. And Cinda was very, very good at that. In fact, she was excellent at that. Her background, her medical background lended well. Her ability to communicate with others was superior. And her drive for doing the right thing, whether it was an investigation from the standpoint of something criminal in nature, whether it was just simply sudden and unexpected, whether it was something as natural as a hospice death that was expected. Her compassion and her kindness was unmatched. She'll truly, truly be missed. She rose through the ranks of the chairs of positions to presidency of the association, recently retiring from that, and made so many positive changes in the association and so many positive changes in professionalism that will long be remembered as a testimony to her many, many accomplishments. So may her soul and her husband's soul and Mr. Evans and the soul of all the faithful departed through the mercy of God, may they rest in peace. Amen.
Representative Shearer is recognized.
Thank you, Madam Speaker. Frank and Cinda gave so much to this world. And when they did leave the world, they had truly made a difference. They say that it's great if you can leave a legacy, but it's even more important if the people that you touch during your life are changed for the better. And that is exactly what we can say about Frank and Cinda. So they both had lives well lived, and they are in our thoughts and our prayers, and especially their son. Thank you.
Body will take a moment of silence. Thank you, members. Representative Calkins, what reason do you rise?
Point of personal privilege.
Please proceed.
Thank you, Madam Speaker. Two things. First, today I would like to recognize former Representative and current State Senator Chapin Rose, who joins us here today. Thank you. Yes. We also have in the gallery with us today a group of young men who are state champions. We have the Monticello boys cross country team with us today. They're the IHSA 1A state champions from last fall. This is the second title, the school history, the first coming in 2014. Our cross country team started the season ranked 7th and rose to the occasion to win the state championship. The team is led by junior Luke Sokowski, who earned all state honors this year, finishing 11th. Our cross-country team is joined by Coach Dave Riemert, Assistant Coach Scott Burns-Meyer, Principal Adam Clapp, and Athletic Director Don Sheehan. Please give them a warm Springfield welcome and a thank you. Job well done.
Congratulations and welcome to the Capitol. Representative Worley, for what reason do you rise?
Thank you, Madam Speaker. Point of personal privilege, please.
Please proceed.
So, what I'd like to do today is read a quote from the former Attorney General for the great United States, who was a senator from Massachusetts. It seems every day we find ourselves in crisis in Illinois when it comes to ethics and corruption and politicians behaving badly. So what I would like to do is just remind people that it is incumbent on all of us to take action when we see it. So with that, I'd like to read a quote from Robert Kennedy. Every time we turn our heads the other way when we see the law flouted, when we tolerate what we know to be wrong, when we close our eyes and ears to the corrupt because we are too busy or too frightened, when we fail to speak up and speak out, we strike a blow against freedom and decency and justice. It's time we get control of illegal activities coming out of this chamber, the other chamber, this entire Capitol. Please heed the words of Robert Kennedy.
Representative Meyer, for what reason do you rise?
Point of personal privilege.
Please proceed.
Well, in my small town of Oakville, this week's headline in the paper is going to read, Oakville wins Class S girls basketball first and second. Now, not many state reps can stand up and say a statement like that, but my hometown had both competitors, Emmanuel Lutheran, which is joined up with Nashville Lutheran, and the Oakville Junior Lady Rockets went to battle, and the Oakville Junior Lady Rockets won the state tournament, and Emmanuel Lutheran and Trinity St. John Titans came in second. So I'd like you to congratulate both teams. Hopefully I'll be able to bring them to Springfield later on. Thank you.
Representative McCombie, for what reason do you rise?
Point of personal privilege, please.
Please proceed.
I'd like to get everybody's attention in the House. You should all have in your mailboxes today something from Illinois Manufacturers Association. They kicked off this event this morning, and an extremely cool thing for all of our districts and our manufacturers within our district, which we all have one. This is to take a moment and to nominate your favorite thing made in Illinois, and then we vote. The nominations close on February the 23rd with voting on the 26th to the 8th. So for example, and in my district, I have LK Manufacturing, so almost every water fountain you see anywhere in the state is made in my very small hometown of Savannah. Over in Noreen's district, we have the Vaughn and Bushnell hammer capital of the world. So we have a lot of cool things in our areas that we should be nominating and talking about and supporting this. There should be something in your mailboxes. Please pass it on, get it throughout your districts, and let's just see who has the coolest product in Illinois. Thanks.
On page 3 of the calendar, under total vetoes, appears House Bill 3902, offered by Representative Bristow. Representative Bristow is recognized.
Thank you, Madam Speaker. Ladies and gentlemen of the General Assembly, today I'm asking you to override the governor's veto of House Bill 3902. I originally brought this legislation to you in November, and it passed 113-0-1. It's a sales tax exemption on aircraft parts that expired, and that was originally enacted in 2010 and subsequently expired. It is similar to the one manufacturing sales tax exemption that is currently in place. 36 other states have the same exemption. This affects 14 aviation facilities in 12 communities and more than 3,700 jobs across the state. This is good economic development, and I ask for your aye vote, and of course, I'll take any questions.
Representative Batnick is recognized.
Thank you, Madam Speaker. Will the sponsor yield?
She indicates she will.
And I was listening to the entire thing this time, Representative Bristow. Two really quick questions. I'm looking at the previous vote total. It looked like there were no votes on the Republican side. Is that correct?
That is correct.
So there were no no's. I think 113 to 0 to 1.
Correct.
And this is not an amendatory veto override. This is just the same bill we voted on before, correct?
It is.
Thank you.
Any further discussion? Seeing none, the chair recognizes Representative Bristow to close.
I ask for your aye vote.
The question is, shall House Bill 3902 pass, the veto of the governor notwithstanding? This motion requires 71 votes, and this is final action. All those in favor signify by voting aye. All those opposed vote nay. The voting is open. Have all voted who wish? Have all voted who wish? Have all voted who wish? Mr. Clerk, please take the record. On this question, there are 107 voting in favor, 0 voting against, and 2 voting present. And this motion having received the required 3/5 majority, the motion to override prevails, and House Bill 3902 is declared passed, notwithstanding the governor's veto. Representative Batnick, for what reason do you rise?
Thank you, Madam Speaker. Point of personal privilege.
Please proceed.
Everybody, it's been a little troubling time for many of us. It's been another week and another reason to have a crisis in confidence in what's going on in this chamber. Last Friday, we learned of yet another criminal investigation that revolves around the General Assembly regarding a former member. I'm not here to politicize the issue or call into question the very confusing facts laid out by the Speaker's office. I do want to express my sincere empathy for the victim. To be put in this situation, it's appalling. I couldn't be more upset to be a member of this chamber when I hear these sort of accusations, and I want to apologize to the victim for the lack of trust in the process where they felt the need to wait years before going to their employers on it. But I do want to be very clear. In addition to the troubling allegations, something that I can't get out of my mind is the reason for the disregard of the judge's order by the Speaker's office. A quick FOIA release on a document that was meant to be kept private is a betrayal of the separation of powers. It is betrayal to the criminal justice process and a betrayal to the oath we take in this chamber. We all deserve answers, and few of those have been coming. But why a document that was meant to remain sealed to protect this victim and protect the case was allowed to come out in the manner that it was? I do hope today that we will learn why this document was made public, and I hope that all members of this chamber understand why this is so important as we attempt to continue the business of the state of Illinois under an ever-growing cloud of corruption and ethical lapses. Thank you very much.
Representative Miller, for what reason do you rise?
Point of personal privilege.
Please proceed.
I'd like to recognize my page for a day, Dylan Harrington. He's a junior at Marshall High School, and he's interested in political science, and also he's interested in pursuing a degree in psychiatry. And I told him, I said, there's a target-rich environment for that here. But anyway, thank you and welcome, Dylan, please.
Welcome to the Capitol. Representative Ammons is recognized.
Thank you, Madam Speaker. Today we want to open Black History Month with a recognition of something that is not too far away and not too distant in our historical record. It's an American story that needs to be recounted and remembered, but also repaid. Today, last year, we acknowledged the discovery of the last slave ship that brought Africans to the United States as slaves. It may also offer a test for the case of reparations. Relatives of the steamship owner Timothy Mayer still live in Mobile, Alabama. And so do the descendants of the people he enslaved. The Clotilda was the last known U.S. slave ship to bring captured Africans to the United States more than 50 years after slavery was abolished. There's a mural in the only town called Africatown in Mobile, Alabama, after the discovery of the Clotilda. The Alabama steamship owner, Timothy Mayer, financed the last slave vessel that brought African captains to the United States, and he came out of the Civil War a wealthy man. His descendants with land worth millions are still part of Mobile society's upper crust. The people whom Mayer enslaved, however, emerged from the war with freedom but little else. Census forms that documented Mayer's post-war riches list them as laborers, housewives, and farmers with no value. Many of their descendants today hold working-class jobs and no wealth. Now, the history of the Mayer and the slave ship Clotilda may offer one of the more clear-cut cases for slavery and reparations, with identifiable perpetrators and victims. When experts said they found the wreckage of the Clotilda in the muddy waters near Mobile, some say too many years have passed for reparations, and others say the discovery of the ship makes the timing perfect. Reparations debates usually involve redress for the multitude of descendants of about 4 million black people who were enslaved in the United States. In Mobile, like many southern communities, descendants of slave owners and enslaved people are often neighbors, though in vastly different circumstances. Originally from Maine, Mayer moved south and got rich off steamboats and a sawmill. He purchased the schooner Clotilda for a reported $35,000 and financed a slave expedition to West Africa 50 years after slavery had been abolished. The international slave trade was already outlawed, but Mayer wagered he could import slaves in defiance of the ban. Arrested after the ship carrying about 110 to 160 captives arrived and was scuffled into Mobile in 1860, he was cleared of all charges by a judge. Historical accounts say Mayer refused to provide land after the war to the freed Africans, who then scraped together money to purchase their own property. They founded a community called Africatown, USA, where some of the West African waves of the once enslaved people are preserved, and its remnants still remain today, and is located in Mobile, Alabama. Thank you, Madam Speaker.
Mr. Clerk, committee announcements.
The following committees were canceled for this afternoon. Appropriations, Elementary and Secondary Education was canceled. Insurance was canceled. Financial Institutions was canceled. Healthcare Licenses was canceled. Meeting at 2 p.m. is Adoption and Child Welfare in Room 122. At 2:30, Judiciary Criminals meeting in Room 118 and Veterans Affairs in Room 115.
Representative Spain is recognized for an announcement.
Thank you, Madam Speaker. Upon adjournment this afternoon, House Republicans will caucus in Room 118.
Representative Willis, Leader Willis is recognized for an announcement.
Thank you, Madam Chair. Upon adjournment, the Democrats will also caucus in Room 114.
Agreed resolutions.
Agreed resolutions. House Resolution 687, offered by Representative Davidsmeyer. House Resolution 689, offered by Representative Hoffman. House Resolution 698, offered by Representative Harris. House Resolution 702, offered by Representative Robinson. House Resolution 706, offered by Representative Mazzocchi. House Resolution 709, offered by Representative Stewart. House Resolution 710, offered by Representative Butler. And House Resolution 711, offered by Representative Davis.
Leader Harris moves for the adoption of the agreed resolutions. All those in favor say aye. All opposed say nay. In the opinion of the chair, the ayes have it, and the agreed resolutions are adopted. And now, allowing perfunctory time for the clerk, Leader Harris moves that the House stand adjourned until Wednesday, February 5th at the hour of noon. All those in favor say aye. All those opposed say nay. In the opinion of the chair, the ayes have it, and the House stand adjourned.